Hi, I'm Dr. Maria LoTempio. I'm a board certified plastic surgeon living in New York City.
What's been happening in terms of plastic surgeons working together to make the BBL more safe for patients? And what kinds of things do you do personally in your office to keep them safe?
Right. So in the state of Florida, they advocated ultrasound guidance, fat injections, which Florida has the highest supportedly reported death or fat embolus. And that's really what we're all scared of is the embolus. The literature is very clear on this. If it's injected in the muscle or below, the chances of a fat embolus is exponentially increased, and what we call mortality or death rate is high. So with me, I don't necessarily use ultrasound. I'm not opposed to using ultrasound, but I just haven't with my last 2,000 patients, is really feeling and really taking my time doing the injection part. I like to do the patients awake. I'd like them talking to me 100%. I don't want them under any anesthesia when I'm actually injecting. They can be under anesthesia a little bit when I'm doing the procedure to remove fat. But when I actually inject, they are 100% awake, they're moving, and they're talking to me throughout the
They
whole
can't
time.
feel it though. They're not in pain. They're
Well,
awake,
see,
but they're
right. So this is a thing. Yes, and that's kind of what you want. But if you go deep enough, you're going to feel pain. So by them telling you something, it's alerting you, hey, maybe something's going on. So that's why I want them awake, because if I'm putting in the fat and they're fine, I'm in the right space. I'm in the right place. And
weirdly, this is why my laser esthetician doesn't use a lot of numbing
mhm,
because she actually wants the feedback because that's how
right.
she knows. Yeah.
Yeah. I mean, and it's interesting. I mean, I think we all like do different things. I mean, I started off training where everyone was under general anesthesia. I mean, first how many years of my practice and training, I mean, they were all zonked and talking to anesthesia and the nurses. And then I started doing everything awake, and I forgot like the patient's awake and engaging in conversations with me. And I was like, okay, now I have to learn how to operate and talk and make sure the patient's okay. So I had to quickly learn how to multitask, which was very easy to do. And now that's how I do it. And that's how I've been doing it. So I think it's safer to do it that way. I always am really pretty much in tune with my patients and what they say and how they say things. And I think they feel pretty comfortable with me so that they're actually pretty honest when they don't think something's going quite right, which, a lot of the times it's nothing, which is what you want. But on that off chance it's something, then you know what? They feel comfortable enough to like, hey, just check it in.
Yeah, that
So
was my next question. Do they ever ask you weird questions? Like, do they try to have
oh yeah.
conversations with you? Like, what are you watching
Uh,
on TV right now, Doctor
oh
L?
my God. So yeah, so like the conversations that we have during the surgery are wild. I mean, oh my God. I mean, I've had every conversation under the sun. I mean, who they're cheating with, or, because don't forget, they are under medication. They do have medication that's somewhat uninhibited. And, they'll say, oh, yeah, I just went on this huge shopping spree and my husband's going to kill me because, we're already doing the surgery. And I'm like, okay. Or they'll say, certain things. It's like, my one child, I love him, but, he's a pip. I'm like,
This
okay.
gives whole new meaning to the doctor-patient privilege. I think it's important that we all remember you can't say anything.
Oh, not a single thing to anybody, or my nurses can. And my nurses, I could see them peripherally, because they're circulating in the room, and certain things that my patients say, and their eyes are like bugging out. And, certain patients, want to talk about politics, and that's a no. We squash that. And sometimes my nurses will like kind of edge the conversation, egg it on. And I'm like, nope, 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 nope. We're not going to talk about that. Nope, 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 nope. We're not
Mm-mm.
talking about world events. Nope, 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 nope. I did get into an issue with one of my nurses. God, must have been like 8 years ago. And we were operating on an individual in a very high position of power in politics, not from this country. And the individual started talking about certain things, and my nurse just went off. I mean, she just lost it. And I'm like, thinking at this moment, like, is like Secret Service gonna come in? Like, or, like what is, I don't want to know anything. And so I'm like, we need to not, I'm kind of calm her down and be like, you know what, let's talk about the weather, and I'm like, that New York winter. Yeah, we haven't had that much snow. Do you like snow? You like snow? I love snow. I'm from Buffalo,
Yep.
and tried to kind of like take that conversation. Yeah, so I'm watching Netflix. What's the movie of the week? I'm like, it's Christmas time. I watch all those Christmas Hallmark movies, and like, to try to kind of get the conversation and come back. But yeah, so it's very interesting. At the same time, I'm actually doing the surgery, and the only time that I'm really not gregarious is actually when I'm injecting the fat. That I'm quiet, because that really requires just a different level of thought. And being a conservative surgeon, which I am, I pretty much shut the music off. It's a quiet room, and I will engage in certain questions at certain times of the injection, so I could hear the patient's voice and understand where they're at. And, it doesn't take that long. The injection part's only, can anywhere be from like 20, 25 minutes. So it's pretty quick.
Mm-hmm. Now, there's no such thing as a BBL without liposuction, because you got to get that fat from somewhere in order to put it there.
But you would be surprised how many calls we get. Just want the BBL. And
without lipo?
Right. They're like, we don't want the lipo.
Where do they think you're going to get the fat? At the fat store?
Know. Yes.
Oh, okay.
I'm
fascinating.
Like, I'll be a donor. Yeah, no, I mean, it's incredible. My staff's kind of like, we all want to be professional, and we all are. But when we get some questions, my staff has to actually tell me some of these questions. And they're like, we're kind of at a loss sometimes. Like, we can't explain to them. We got to get something to put something in.
Mm-hmm. Where can we see these results of yours?
Real Self, online. More importantly, come to my office, Fifth Avenue, next to Sephora.
Is there anything we can see on Instagram?
Yeah, some of them are, except Instagram has an issue now that they constantly take. Yeah, they're constantly taking it down now. I tell people, like, go meet your surgeon, go talk to them, go see their before and afters. I have, 200-300 slides.
So
of BBLs.
If there are some photos online, there are many more to see when we come to the office.
Yeah, and those we just can't put online. Right. A lot of them, those are just, we can't, for various privacy reasons, confidentiality.
Too beautiful to see. You just got to come in.
It's all about the beauty of the booty.
Links to our guest's website and contact info are in your show notes. Follow us on Instagram at Where Before Meets After. Where Before Meets After is a production of The Axis, the podcast agency for aesthetics. TheAxis.io.